The Fugo Plasma Blade is a surgical game changer in ophthalmic surgery. It's the last thing that those big ophthalmic companies want you to know about. It will allow you to do capsulotomies in seconds, works on all patients, unbelievably versatile, and amazingly cheap. $20,000, under $20,000 for the console, complete system. And look at that right there. That's under $20 at disposable tip, and it can be reused offshore over 100 times. Under $20. We made a perfectly round capsulotomy, and we're showing you here. If you don't like it, you can revise it and make it bigger. There's no other system on the planet that will allow you to do what we just showed you. Now, you can use some of the diathermy systems, but they usually stick to the capsule. This thing will stick to no capsule because it'll even cut sclera, it'll cut cornea. It's unbelievable because you're using plasma ablation. Here, we're actually going, look at this, under the iris, a little bit under. Now, I want it larger. Okay, fine. I'm going to go further under the iris. There you go, further under the iris and make it larger. This is impossible to do with any other technology. You cannot do this because you're gauging the size and the location of the capsulotomy by using plasma. It's the only way to do it, and we have the only system, and it's inexpensive. Here we're going to, what are we doing here? Okay, we're going to make it regular on the right side. Now I'm going to intentionally right here make it irregular on the left side. You notice how I made an irregularity? Why did I do that? Because I'm going to show you right now how simple it is to go back there and to ablate out a crescent. And look at this. I've converted an irregular to a perfectly regular capsulotomy. Again, impossible to do with any other technique or any other device. And this thing is less than $20,000. Why don't you own it? I don't understand the people who don't use it. Again, I'm going up under the capsule a little bit there. And here I'm intentionally placing a round capsulotomy eccentrically. In other words, I'm pushing it off to the side, and I'm putting it centered mostly into the upper right-hand quadrant. Now, why would I want to do that? Because, again, I'm going to show you, you can take our quadrants and actually recenter it. Okay, we're going to take out little crescents here, and I've made that left side regular. Now I'm going to get down inferiorly and make that regular. And you go, gee whiz, you have bubbles. Yes, as you do with the femtosecond laser, because we both use plasma. And you're going, oh, all those tracks in here, is that coagulation? No. This is, again, just with a femtosecond laser, if you see what they do, they cause a fracturing of the molecular lattice of the cataract itself, ergo changing the refractive index or the index of refraction, thereby it looks different. Now here is something impossible to do. Here there's a tearing capsule. I'm going in, I'm examining the area. I'm going to actually take this left hand, you see that tear up there superiorly, and I'm going to take that edge right there and I'm going to pull on it a little bit right there, gentle, 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 gentle. And I see that the only place that has a problem is there at around 12:30, 1 o'clock up under the iris. So I'm putting a little viscoelastic, the cannula. I'm using Teflon, it's very gentle. Cannula, and putting a little visco to pull the iris up so I can see that head, and I can just picture where the two edges are going to meet there, and you can get an estimate, but I want to actually see it. So I'm going to twist the globe over, and you'll, for a second, right there, you see it up there around 1 o'clock for a second, right there, up there, around 1 o'clock. That's where it is. So I can see where I have to go. What I want to do is I want to get my Fugo Plasma Blade, and I'm going to go up and ablate right in front of the tear, and that's going to stop the tear because you've put an ablation path in front of the tear. Remember, this tear has acute margins. Any ablation path is, if you look at the edges, are round. There are no acute angles, so it can continue to tear. So by putting an ablation path in front of that tear, you in effect have stopped this tear in capsule. Now, unfortunately, this patient is quite sick. He has some dementia. He's moving around. He's got tons of medical problems. And I just had to intercede here and get this ablation path in because I was afraid this thing any moment was just going to speed out into the periphery and we were going to lose this thing. But it didn't. And then the anesthesiologist has calmed him down at this point, and he's going to relax here, and I'm getting him a little organized, relaxing him. Now we're ready. I'm more relaxed, certainly. My coronary arteries feel better because now I know this thing isn't going to continue to run because I have an ablation path in front of it. I also have viscoelastic in there, and we didn't have any vitreous appearing in the anterior chamber. Actually, I put a patch of very dense viscoelastic over the opening. I'm dropping the lens in very carefully, though. You don't want anything to slip through that posterior capsulotomy. That there essentially is a primary posterior capsulotomy, and we can. All right, we have this lens in the posterior chamber, and I'm going to very gently rotate it. Now, usually I rotate it from the haptic towards me, but I'm going to actually take that distal haptic, grab it, and pull it into the bag rather than pushing it against the posterior capsule so it doesn't go through the posterior capsulotomy. So what I've just shown you is a versatility. Now, take a look at this. How can you not love this? This saved my patient a complication, saved me a complication. It gave him much better vision. I just saw this patient a couple of weeks ago, and he's a happy, content, wonderful fellow, and I'm happy for him. And I was glad that we could do this because without the Fugo Plasma Blade, this would not have been possible. We're offering you an opportunity for really peanuts in the medical field, under $20,000 for hardware. I mean, you pay that for some phoropters and special slit lamps. And take a look at this. This is such a nice um, resolution to a case that was a real nightmare, a potential nightmare. We turned it around, made it good for the patient, made it good for everybody. And this case cost me, for the case disposable, under $20. It's a wonderful technology. We're going to show you many things that you can do with this, and the device pays for itself because you can do a filtering surgery that will decrease complications of surgical filtering to much dramatically over that of trabeculectomy, and you can do it in about 15 minutes. Anybody in ophthalmology can learn how to do this procedure. Why don't you try it?